Hello doctors, welcome back to the lecture series of the lower limb. In this video lecture we will discuss the osteology of the lower limb. Student, the lower limb has hip bone, femur, tibia, fibula, tarsal, metatarsal and phalanges. So first we will discuss the osteology of the hip bone. Now student, as you can see, the hip bone articulate with the sacrum at the iliosacral joint, and also the hip bone medially articulate with the another hip bone at the symphysis pubis, and laterally hip bone articulate with the femur bone. Now student, this is the anterior view of the hip bone. So student, the hip bone is formed by the fusion of the three bones. This is the ilium, this is the ischium, and this is the pubis. So by the fusion of these three bones, it formed the hip bone. Now student, as you can see, this deep depression which is formed between the three bones, it is called the acetabulum. Student, the acetabulum play important role in the articulation with the femur bone. So student, first we will discuss the bony features of the ilium bone. As you can see student, from the anterior view, this is the anterior side and this is the posterior side. So at the anterior side we have two spines. This spine is called the anterior superior iliac spine, and the spine which is present below it is called the anterior inferior iliac spine. Also from the posterior side we have two spines. This spine is called the posterior superior iliac spine, and this spine is called the posterior inferior iliac spine. Also you can see this rough elevation, this is called the iliac tubercle, and at the posterior side this larger notch, it is called the greater sciatic notch. Now student, from the superior view you can see a crust which is called the iliac crust. Student, this crust run from the anterior superior iliac spine and ends at the posterior superior iliac spine. Now student, the ischium bone. Student, as you can see at the posterior side, ischium bone has a spine which is called the ischial spine, and here we have a smaller notch which is called the smaller sciatic notch. Now student, the ischium bone has two parts. This thick part is called the body of the ischium, and this narrow or thin bone, it is called the ramus of the ischium. Now student, the last bone which is the pubis bone. Student, the pubis bone has three parts. This superior part is called the superior ramus, and here this part is called the body, and this part is called the inferior ramus. Student, the superior ramus articulate with the ilium and the ischium bone at the acetabulum. As you can see, this is the part of the ilium bone and this is the part of the ischium bone. Now student, the body of the pubis bone articulate with the another hip bone at the symphysis pubis, and the inferior ramus of the pubis bone articulate with the ischium and form this obturator foramen. This foramina is called the obturator foramen. Now student, as you can see, the floor of the acetabulum has a fossa. This fossa is called the acetabulum fossa. This play important role in the attachment of the ligament, and at the inferior we have a notch. This is called acetabular notch, and here the obturator artery passes and supply the head of the femur bone.